Graves' disease is a condition where your immune system makes your thyroid work too hard. This can cause a lot of problems in your body. The thyroid is a small gland in your neck that controls your metabolism. With Graves' disease, your immune system attacks your thyroid, making it produce too many hormones. This condition is most common in women between the ages of 30 and 50. If it's not treated, it can lead to serious complications, even death. But if it's diagnosed correctly, it's usually easy to treat. Sometimes, the disease can go away on its own after a few months or years. Graves' disease is an autoimmune condition that causes the thyroid to become overactive, leading to a condition called hyperthyroidism. This means that the thyroid gland produces too much hormone, which speeds up the body's metabolism. As a result, patients may experience symptoms such as a fast heartbeat, excessive sweating, trembling, and weight loss. In addition to these symptoms, some patients with Graves' disease may also develop thyroid eye disease, which causes swelling of the eye muscles and tissues, leading to protrusion of the eyes from their sockets. The cause of Graves' disease is believed to be related to the immune system producing abnormal antibodies that act like thyroid-stimulating hormone, TSH, causing the thyroid gland to overproduce hormone. While the exact reason for the immune system malfunction is unclear, factors such as heredity, gender, with women being more likely to develop the disease, and smoking have been associated with an increased risk of Graves' disease. It is thought to be triggered by a combination of genetic and environmental factors. When you have Graves' disease, you may experience symptoms like feeling nervous, anxious, or irritable, weak or tired muscles, shaking in your hands, frequent bowel movements or diarrhea, difficulty sleeping, sensitivity to heat and increased sweating, unintentional weight loss, an enlarged thyroid, also known as a goiter, fast or irregular heartbeat, changes in menstrual periods for women, erectile dysfunction in men, decreased sex drive. Eye complications. In some cases, people with Graves' disease may experience a condition called thyroid eye disease. This can cause swelling of the eye muscles and tissues, leading to a protrusion of the eyeballs from their sockets. This is known as exophthalmos and is considered a rare but notable symptom of Graves' disease. It's important to note that the severity of Graves' disease does not necessarily correlate with the development of thyroid eye disease. It's not entirely clear whether these eye complications are a direct result of Graves' disease or if they are related to a separate but closely linked disorder. If you have thyroid eye disease, you may experience symptoms such as eye pain, dryness, irritation, excessive tearing, and redness. In severe cases, the swollen eye muscles can put pressure on the optic nerve, potentially leading to partial blindness. Additionally, prolonged inflammation can weaken the eye muscles, causing double vision. Skin complications. Some individuals with Graves' disease may also develop a rare skin condition called pretibial myxedema or Graves' dermopathy. This condition is characterized by lumpy, reddish thickening of the skin on the shins. It is usually painless and not considered serious. Similar to thyroid eye disease, the onset of pretibial myxedema does not necessarily coincide with the development or severity of Graves' disease. If you have symptoms or signs of the complications of Graves' disease, your doctor may order a series of tests to help diagnose the condition. A blood test to check your levels of thyroid-stimulating hormone, TSH, and other thyroid hormones. With Graves' disease, your TSH levels are usually low, and your other hormones are elevated. Lab tests to look for the antibodies that cause Graves' disease. If these antibodies are not present, it may indicate that your hyperthyroidism is caused by something else. A radioactive iodine uptake test to monitor how much radioactive iodine is absorbed into your thyroid from your bloodstream. If a large amount of radioactive iodine is taken up, it may indicate that your thyroid is overactive. A thyroid scan to see how the radioactive iodine is distributed in your thyroid gland. If the iodine is distributed throughout the entire gland, it suggests that you have Graves' disease. As with other causes of hypothyroidism, only certain parts of the gland are affected. The two main goals in treating Graves' disease are to stop the thyroid gland from overproducing thyroid hormone and to prevent the increased hormone levels from causing problems in the body. There are several treatment options available to achieve these goals. One treatment option is radioactive iodine therapy, where you take a different form of radioactive iodine orally. This iodine targets the thyroid and kills some of the cells that are producing excessive thyroid hormones. However, this treatment may temporarily worsen any eye problems caused by Graves' disease and can lead to lower than healthy levels of thyroid hormone. If this occurs, it can be treated, but this therapy is not suitable for pregnant or breastfeeding women. Another option is medications, such as antithyroid medications, which reduce the production of thyroid hormone. These medications are not permanent treatments but can be used for extended periods and may continue to be effective even after stopping treatment. They are often the preferred treatment for pregnant or breastfeeding women who cannot undergo radioactive iodine therapy. Beta blockers, typically used to reduce blood pressure, can also be used to rapidly relieve symptoms of hyperthyroidism, such as shaking, rapid heartbeat, and anxiety. Surgery is a less common treatment option but may be necessary if there is a goiter present or if the patient is pregnant and cannot take antithyroid medications. During surgery, some or all of the thyroid gland is removed, and afterward, the patient may need to take a daily thyroid medication for the rest of their life. It is important to seek prompt and proper medical care for Graves' disease to prevent any long-term adverse health consequences.